Clinical trials can transform survival and quality of life. But what happens when a cancer is so rare that research barely moves forward, and when access to trials depends on where patients are treated, which language they speak, or how confidently they can navigate the system? We're Sciana Cohort 7, Mridul Agrawal, Raquel Correa, Judith Dios, Claudia Schade, and Andreas Welker, exploring how trust can strengthen meaningful participation in clinical research. In this interview, Karin Strube shares her perspective as a physicist, a survivor of a rare soft tissue sarcoma, and a patient advocate working to advance health literacy and shared decision-making. She discusses research gaps in rare cancers, practical and linguistic barriers to participation, the importance of quality of life, and how patient involvement can make clinical trials more relevant and accessible. How can we create a research system in which more patients can understand, trust, and help shape the trials that may determine the future of care?
Hello, thank you for your participation. I'm very glad that you are with me today. And before we start with our actual theme, I would like for you to make a short introduction. Could you briefly tell us about your current role and what brought you into patient advocacy and patient involvement in research?
Yes, hello. My name is Karin Strube, and I'm an educated physicist. I am currently running the Strube Foundation together with my husband, and I'm a managing partner, or in Germany we say Geschäftsführender Gesellschafter. As a very young woman, I had a rare soft tissue sarcoma, and it was very difficult to be treated. The likelihood of survivorship was very low, like about 10%. But nevertheless, I managed to survive. The doctors managed to treat me successfully. And of course, that is an impact that stays in your mind. After my illness, I worked for more than 20 years for the Bosch company. But after the death of my mother in 2017, my father and myself decided to create this foundation. And we wanted to have topics for health literacy, with core aim is to support shared decision-making for patients, mainly in oncology area.
Thank you very much. And actually, that's a good start into our topic because we are looking at trust and clinical research at the moment. And from your perspective, which experience have most shaped your view of clinical research from the patient perspective?
I had a very rare soft tissue sarcoma for which there's basically simply no clinical research available at all, and was not in the past and will never be in the future because it's simply too rare. And that really, when I working for the foundation, I thought that because then my illness was like 25 years in the past, and I thought that of course the treatment would be totally different by now and the survivor percentage would be much better. And I was so deeply shocked when I first time researched this again, and I found that basically nothing had changed. Absolutely nothing had changed. So the treatment was still the same as in the past. Even the medication was still the same as in the past. The cytostatics was the same being used, and the survivorship had not changed at all. And terrible eye-opener for me because some other cancer diseases have changed so much. For example, all the blood cancers, they have changed dramatically. Like in the past, for example, children, they were like doomed to death if they had like a leukemia. And by now they are like have a survivorship like over 80 to 90%. And that is, of course, due to clinical trials. Basically, my only hope for people like me is that someday when we do genome sequencing of the tumor itself, you might find some parts that like a driver mutation, so like a trigger mutation, and that you might then be able to use some medication against that.
And just for clarification, we have viewers from other countries too. So from your perspective, how do patients in Germany typically hear about clinical trials? How do they get enrolled, for example?
It's a really good question, and I must confess that I'm not totally able to answer that. Since I am so deeply involved in the National Centers for Tumor Diseases, I'm always connected with a lot of patients who are very aware of the availability of clinical trials. So my impression is that you have these kind of patients who are very well educated, have a higher education, are very literate, who are able to speak English as well, who are willing and able to do some deeper research by themselves. And of course, they are very able to find the clinical studies. The other side is, I think it's very important, and if you're lucky, if your treatment is on a university hospital. So because research being done is in these major clinics, which have a university medicine background, I think you are in bad luck if your treatment is some small town with some small clinic where one doctor is doing everything more or less, yeah. And I think there it's really difficult for a doctor to tell you about a clinical trial or you finding it out by yourselves. I believe that the self-help groups also talk about clinical trials, but maybe not to the amount that they could. Yeah. I think it depends quite a lot on the people present in the self-help group. Some are more aware of clinical trials, others are not. Yeah, so I think, and then we also have a big issue with people who are not so fluent in German. I think for them it's really quite hard to get access.
Yeah, we'll circle back to this point later.
Yeah.
You said you had many contacts to people who are well informed about clinical trials. At what point in the cancer care pathway are clinical trials usually discussed with the patients? Is it more like a last resort, or are they discussed very early in the...
So my background is in oncology, and I actually can speak only about that. So I don't know for other illnesses, for heart or whatever. So in the oncology, it is mostly in a very late stage of the illness. So basically, after you have done some, let's say, the normal treatments that already are accepted treatments, only when they are not working anymore, then you can join a clinical trial. So basically, you always need to first do the normal treatments, and when they don't work anymore, only then you are allowed to join a clinical trial. And the basic
I
thinking
see.
behind from the normal treatments, they are well known, and they are known to be working well, yeah, to be effective. And from the clinical trial, of course, you don't know. Basic thinking is always you should first get the well-known and known for effectiveness treatment. And only when it turns out this treatment is not working, only then you go to the treatment where you need to find out if it's working, yes or no.
Okay, I understand. And if you look at the presentation, how the wording, for example, is when you present a clinical trial, are they normally presented as a normal treatment option, or more like an access to innovation, or even like a last resort, as you mentioned before?
Of course, they are mostly not presented like a normal treatment because they are not. It would be a lie if they would tell you this is a normal treatment. It's not, yeah. And basically, of course, then the researchers who want to do the clinical trial, they are more presenting this like a way of innovation, also like a possible chance, yeah. So if you talk to the researchers, they would prefer to have the patients in an earlier stage of their illness, because at the moment, many treatments base on enhancing the immune system. So if you had already so and so many chemotherapies, your immune system is very, very used up. But if you want to do a treatment where the T cells are supposed to be enhanced, of course, it's not so good. So the researchers would prefer to have the patients in an earlier stage, but as I said, by rule, it's not possible.
And now when we change the perspective, like when you see what these things evoke in the patients, how do they get the term clinical trial? Is it hope or uncertainty, risk, being experimented on, or something else?
I think this has changed quite a lot in the last years. I think in the past it was really more this view of being experimented on, yeah. the famous Guinea pig. Lately, I think it has really changed a bit towards the chances that are connected to clinical trials. But I also believe that this is also a little bit connected to educational background. Yeah? So the people with a high level of education, they see rather the chance. And this is like storytelling. Yeah? So what I hear from people, so I don't have a statistics I can present to you, but the comments I hear from people is that quite often the people with a lower
Yes.
level of education, they see more the threat of being experimented on.
And if you get like patients who are hesitant or who even say, I won't do it, what are the most important reasons for them for hesitation?
I personally tell you from any of my fellows I know who decided not to do any clinical trial, sometimes what really happens, because it's sometimes so late in the treatments of the person that there's some level of fatigue. And also to be sincere, since you don't know if it's going to be really helpful or not. And sometimes people really think, okay, now maybe I have only a few months left, so I need to decide how I want to spend them.
And if we look at the practical barriers from the patient perspective, for example, travel time or additional appointments, income loss even, or you mentioned like language barriers, for example, which practical barriers did you encounter?
So the travel is really a big issue because the clinical studies are super specific. Yeah? So you have you're not only doing a clinical trial for an illness, but inside of the illness you need to have certain markers, tumor markers, whatever. You need to have blah 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 age and so on. So it's super specific, and mostly there are also a small amount of patients who can actually join this clinical trial. I have heard of people who really travel to attend a clinical trial like 3 hours one way or so. And it's not like mostly you need to go and go again and again. Yeah. So this is really a hardship for the patients. And also, to be sincere, besides the effort it takes, you need to have the strength to do it. Yeah, you need to have enough health to either sit in the car or the train or however to travel all this distance. And so monetary wise, yes, you don't get paid everything, but mostly you get paid. Yeah. I don't know. So I don't think that monetary wise it has such a negative impact. But as I just said, clinical trials are getting so specific. Yeah. So for example, I was supporting a clinical trial against prostate cancer. And a lot of men wanted to attend it, yeah, but they did not match exactly the requirements. So they simply could not. Yeah, because the requirements are so specific for you, they simply could not. That's the main reason why people are not attending, because they simply don't fulfill the requirements. We're talking about language very often, if not to say, I think as far as I have checked the requirements sheets, the ability to speak German is almost always there. So it's a requirement for you to attend the clinical study is that you are able to speak German.
I see. Okay.
Yeah, because conversation necessary. And I think you also have the complex consent documents, yeah? Of course, you need to be able to understand them.
Yes.
And therefore, it's also a requirement that you are able to speak quite well German in order to understand the complex consent documents.
And beside the language barrier, are there patient groups in your perspective who are systematically underrepresented in clinical trials?
So this is, how should I say, welcome to Germany, yeah? We don't have any statistics on that. And I think this is really a shame. So if you look at, for example, United States, United Kingdom, whatever, they have really, really good statistics on showing who is showing up in which, for example, trials, but over also diagnostic, time frame, overall survival, and so on. So we lack the statistics for that. But in the hearsay level, yes, we have a huge problem with who is attending the clinical trials. It's mostly the Germans who don't have a migration background, but who have been Germans, for example, more or less forever, yeah, who have a higher education, who are able to speak English, And yes, very fluid. Yes. And if you, of course, it's not like there's none of the non. Also from, okay, of course, people with some migration background, they might be attending, yeah, especially if they're like the second generation who already have fluent in German. It seems to be that we have a lower number than the population would be.
And you already said that some patients' organizations are trying to get people into trials, and some are not. So do patient organizations or patient advisory structures collect data on trial access, for example, or on barriers?
I'm a sarcoma survivor. There is the German Sarcoma Foundation. And on their homepage, they have a site where they have all the clinical trials on sarcoma that at the moment are ongoing and where you could apply as a patient. Yeah? If they do any checks on why people don't join. Was this your question?
Yes. Yes.
So again, so from my point of view, and this is of course very limited overview I have, yeah. But what I mostly notice is that really the requirements are so specific that sometimes people who would like to join cannot join. Yeah?
If we look at the topic from another direction, like about trust communication and narratives, are there ways of communicating about trials that unintentionally create mistrust or make patients feel pressured, for example?
Pressure to join?
Or yes, for example.
I think what really still is really a huge issue is the overall way of doctors and researchers to speak. Yeah. There's this issue of using complicated words, of using scientific words, and all these words are available also in German. You could basically say the same thing in just normal German words. I think this is something that you go on a homepage, or you open a site, you look into it, and you say, okay, sorry, I don't understand that word yet. Then you close it again, finished. So people feeling a pressure to join, I wouldn't have heard of that.
And if we look into like pub media or politics or social media, for example, how important are public narratives about trials for the patient's willingness to consider joining a trial?
So I think there we really have a huge weakness, because basically in the public, in the media, social media, there's no communication at all over clinical trials. So notice half a year ago, the Funke Mediengruppe started a huge campaign called Studien wirken. Yeah, so clinical trials are effective, basically saying in English. Yeah? And so Funke Mediengruppe is just like a newspaper, and mostly they are not famous for high quality. But nevertheless, they really started doing this now, and I think it's really, really good. And I personally think it's a very good idea, because I think that most people simply don't know where medication comes from. Yeah, like they think, like, where does it come from? I go to the pharmacy and I buy it. Yeah, yeah. So the whole concept, where does it come from? How do you develop a medication? People have no idea. Yeah, this is really the first step. Yeah, you first need to make people aware of it, that medication is not growing on the trees, or it's the same as ever. Yeah, I don't know. Some medication we have is like for decades. Yeah, so aspirin or whatever. you know this medication for decades, and you think, yeah, it's there forever. Yeah, and I think it's really important to create a more awareness. Yeah, about that medication needs to be developed, and that's really a huge thing. Yeah.
Yes, I see. And in your work with patient advisory structures, where have you seen patient input actually change research priorities or trial design, or, for example, information material or recruitment strategies?
Yes, of course. Yes. So this is really one major topic of the National Center for Tumor Diseases. And that's also why the patients have been involved so deeply there. But even before that, I think one thing that has changed in the last, let's say, 1-2 decades, for quite a long period of time in oncology, the overall survival was the thing. Yeah. So simply, how long is the person living after having this treatment? And people just running after statistics. So if you survive 3 months longer than with the other therapy, whoa, big gain. Yeah. But nobody looked at how does the patient feel during these 3 months. And sometimes it turns out that you're living 3 months longer, but you're feeling like a total crap throughout the whole therapy. So basically, yes, good for nothing. If you cannot do nothing, you
I
cannot
see.
spend your remaining life in any good way. You're just there suffering. And I think this was a message that was conveyed by the patients since quite some time. And therefore, also since quite some time, there's more focus on the quality of life or health-related quality of life during a treatment than it was in the past. I think this is really a big gain. We are also getting involved very deeply in all this information towards patients, on like using normal German words and not always speaking only in scientific language. For example, also using some graphical designs or some pictures of the part of the body that's being talked upon. And I think that always also helps. So I'm surprised to see how the doctors really have changed the way they talk and explain. We have also, of course, have some impact on which patients are supposed to be recruited by the clinical studies. For example, in the area of sarcomas, quite often younger people are affected. And so, for example, there was a big study being prepared, and which is quite normal that you have the lowest age you can attend the study is at the age of 18. But in this specific study, the specific illness, quite often even teenagers or children are affected. So therefore, also for them, it would be important to join. So this kind of point of view that you really consider changing also who should attend this study.
I see. That's very interesting. Thank you. And how do you assess whether a trial is meaningful for a patient, for example?
Yeah, for me, that really absolutely is also this health-related quality of life. Any treatment that worsens your quality of life is really going the wrong direction. Of course, Of course, you always need to consider the timing. So when I had my chemotherapy, of course, I had much worse quality of life during the chemotherapy than even before I started treatment when I was seriously ill. Of course, this is something that happens during therapy, But then you need always check, okay, is this something that will be like, I don't know, for a few weeks and then it goes away and then maybe it's another few weeks and then you go back to your normal? Or if this is something that is going to be destroying your quality of life over really a major time frame. But this also, I really think it's so important to really talk openly to the patients, tell them also what will happen to them, how they are going to feel throughout this treatment. And they're really then going into the shared decision making so that the patients can really decide if they are willing to accept this or not. And it's really very important to have a very open conversation with your doctor.
I see.
So when we talk about overall survival, so I just made an example of 3 months. So when I had my illness, I was at the age of 28. 3 months for me would have been simply nothing. I don't care. So I was really going for 30 years that I have survived now. And it's so important to also talk about this with the patient. Maybe the patient, for the specific situation, whatever, 3 months is good. Preferred than to not having 3 months. Important really to talk clearly between the doctor and the patient.
From your perspective, how can health systems avoid shifting responsibility onto patients while still strengthening patient agency?
I must say that I have never seen such a case where the burden was all given to the patient. In your illness, you're always the one who is carrying the burden overall. No doctor can carry the burden of your illness. Are you rather now considering in shared decision making where then the patient to make decisions if he's going left or right or up or down, or what do you mean? Yeah. This lately where it's shared decision making is being understood in a weird way, So that really the doctors are simply pushing the whole decision towards the patient and you tell me and I do it as you say, yeah. And of course, that's really not feasible because the doctor has seen such cases quite often and the patient is seeing it for the first time for him or herself, yeah. I simply would say to the patient, do not accept this, yeah. So if the doctor is pushing the whole responsibility towards you, then push it back. It cannot be, yeah.
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 And if you could change anything you want, like legislation, money, whatever, what would be your changes you would make for the German trial systems?
Okay, so this is no news. Really reduce bureaucracy a lot, yeah. Digitalization a lot, yeah. For example, start using of artificial intelligence, for example, for translation, yeah. Why not? I think that we at the moment are really not being as effective as we could because we have so many self-given, self-chosen barriers.
And are there parts in the interview we did not get to at the moment? Things you want to say and you want to add where I didn't ask at the moment?
This is a wish I always have. I really would wish that we would have much more patient advocates, yeah, which requires that you, on the one side, you learn about clinical trials beyond of what your own personal illness and treatment was, yeah. And of course, it's always, yeah, it's also it's quite busy, yeah. You need to take time to do that, yeah. But I also think it's very rewarding. So I really would hope that more people would join our, let's say, our lot to be a patient advocate.
I see. Thank you very much for your time. It was very interesting and I learned a lot.
Okay.
Thank you very much for your time. I appreciate it.
You're welcome.
Bye.
Bye.